we're gonna show the application of a thumb Spica cast. This video is a version with the IP joint free, so it'll allow the IP joint of the thumb to move, and we will talk about at the end of the video doing it to the tip of the thumb.
Thumb spicas are used mainly for thumb injuries, scaphoid or navicular fractures.
So always give yourself extra stockinette on distal and proximal ends so you can fold it back nicely over your first layer of cast material. And keep in mind the first layer of your cast material will determine the length of the cast. Positioning for this cast, we often tell our patients to hold their hand as if they're holding a can of soda. They just kind of naturally hold their thumb in a neutral position, and depending on the injury, the physician may ask you to position the thumb a little differently, but for the most part, you just want the thumb in neutral and the wrist in neutral. And also, depending on the injury, will make the deciding factor on the length of the cast up the forearm. Anything at the wrist, like the scaphoid, you're going to want to go a little bit farther proximally to give it more stability. When if you have a thumb injury, you can go closer to the wrist on the length.
Depending on how fast you want your cast material to set up is on how much you submerge it in the water and how tight you squeeze it. Some people don't even like to actually dunk that in the water.
Cutting the cast material around the thumb makes for a nice, clean cast, snug fit. Some people will take and fold the cast material and lay it in there. If you cut it, you can make it fit nicely and it'll be a lot thinner, more comfortable. Same thing through the web space. We'll cut just like we did on a short arm cast. We'll use the same technique as we cut through the web space and catch those edges. And then 50-50 up the forearm proximally.
Once again, you can see a little bit of tension here to assure that this cast is fit snugly. One thing you want to do is find that happy medium of how much tension you'd like to put on the cast as you apply it. It needs to be snug but not over tight.
Once you put on that first layer, you can tell that it starts getting a little bit sticky, starts sticking to your gloves as you're molding. So you can just dump your hands back in the Pella water, run them underneath the sink, whatever you're doing, just get your hands wet. That helps you be able to mold the cast in the right position and helps keep that resin from sticking to your gloves.
So when I mold for a thumb spica, always do an interosseous mold on the wrist, forearm area, and then you can take your opposite hand on the palm side and almost grasp the hand, and then you can also kind of pinch the thumb just slightly to give a mold through the thumb area. Especially if you're going past the thumb, you can kind of mold the thumb to make it fit properly.
It's also very important to check the alignment of the hand. A lot of times the patient will start getting tired from holding their hand up and they will go into ulnar deviation. You'll get a buckle right there in the ulnar aspect of the cast. So again, make sure you have that proper alignment as you're molding in the palm of the hand. Make sure you're kind of molding a radial mold as well.
Very important aspect of this cast is proper molding and making sure that this cast remains well fit and snug throughout the duration of the fracture treatment. Scaphoid fractures are very hard to heal, and a loose cast will not help aid in the proper treatment of the fracture.
A lot of times you'll put multiple casts on throughout the treatment. Rather than putting one cast on for 6 weeks, you'll put one on for 3 weeks, have them come back, and then put another one on for another 3 weeks to ensure that the cast is molded and fits well. The patient's going to atrophy no matter what, and that will cause a little bit of play in the cast. That's why we really like to put a good mold on the cast. This shows the movement in the thumb. Just having that IP joint free is very convenient for the patient. They'll be able to grasp things a little bit better, and they'll appreciate that. We've got the first layer on, it's nice and solid, or it's close to it, and we're going to start on the proximal end and work our way distally.
One thing that's advantageous about going proximal to distal is that by the time you get to the end where you're going through the web spaces, your cast roll is thinned down and it's a lot easier to handle through the end of the application here.
At this point, you can hold your cast tape distally where you want it to end and then just cut it on the volar side, and you can do that twice so you can get 2 layers in there. This just makes it so you can have a nice clean edge on the distal side so you're not past your padding up into your thumb. And by cutting it, you're not bunching it up down towards the palm. Your patient's going to appreciate it because it's going to look kind of nice too.
Thumb spicas are actually quite fun to put on. Once you perfect this, patients really appreciate your cautiousness and your ability to make it look good.
Oftentimes, as you're doing the thumb spica, the patients just kind of sit back in awe, and they'll often say that they can tell that that's not your first cast you put on.
One thing to try if you're starting out, as you're trying to perfect this cast, you can take either an ace bandage or just the cast padding, which is not as expensive as the cast tape itself, and just practice rolling through that web space, going around the thumb. It's easy to go 50-50 all the way up the forearm, but practice rolling through the web space around the thumb, different directions. You'll learn how to just lay down the cast padding, and then once you figure that out, you're going to be wrapping your cast tape in the exact same manner that you did your cast padding. So just play with it and figure out what way is best for you.
The more aggressive you rub these, the smoother they become, and the more they look like a finished fiberglass product. It looks really nice. It speaks for itself what kind of cast technician you are.
Yeah, sometimes if you don't rub it down really good when you get finished, as it's hardening and curing, some of that resin will actually bubble up and make some really weird bubbles, and it's just very rough, and you can tell that you haven't smoothed it out very well.
And the areas you cut around the thumb, they can start to splinter up if you don't rub it down adequately. So here you can see an example of a thumb Spica cast just past the tip or to the tip of the thumb. This is done by extending your cast padding up to the tip of the thumb, and then as you're doing your cast layers, you're just going to pull that up a little bit higher, so that will make your cast go to the tip.
It's actually a little bit easier for your cast tape to go through that web space because you have a little bit more length.
You don't have to cut as much. We're going to show you how to take a cast off, proper techniques. Anytime you take a cast off, depending on what type of cast, you want to know your bony prominences. Using the cast saw, you want to keep that blade moving. You'll see us use different techniques in our other videos. The main thing is you just want to keep that cast saw moving or else it'll get hot. As I'm going, I will often check with my index finger the blade to make sure that it's not heating up, and just make sure you don't cut near the bony prominences. Even if you don't cut the patient, it's going to be a spot where you hit them and then it will scare them. Cast spreaders are nice. Even if you don't cut all the way through, in some areas the cast spreaders will be able to pop it apart, and so you don't have to go back and use the cast saw.
On the cutting technique here, just make sure that you use some good bandage scissors. There's nothing more frustrating than using some that don't cut very well, and then glide it across the skin with ease so that you're not poking into the patient and dragging it, causing any abrasions.